Hello and welcome. This is Jim McKinnell, Director of the Office of Pre-Health Professions Student Development at the University of New Mexico. And this YouTube channel is Planning for a Career in Healthcare. Today I want to continue the talk that I started in the last video about shadowing, and I'd like to get down into some of the more specific things that I'd like you to be thinking about when you walk in the room. I mentioned in the previous video that shadowing as an activity is very complex, and a lot of times the complexity of the interaction that students are witnessing is sometimes lost on them. I want to take some time and break that down for you. I want to talk to you today about thinking about the patient, about thinking about the provider, and I want to also address, and I think this is probably going to take a separate video, I want to talk to you specifically about the whole challenge of effective communication whenever a healthcare provider meets with a patient. So you walk in the room, and most of us are really excited because this may be our first opportunity to see a real patient when we're shadowing a provider. And we're real excited to see the patient, and we tend to focus a lot of our attention on the patient. But I want to remind you all that none of you are watching this video because someday you hope to be the patient. You all hope to someday be the provider. And so it's also really important for us to take special note of the provider and what the provider is doing and the efforts that the provider is making as he tries to fulfill his duties, which is to take care of the patient that he's visiting with. Lately, I've sort of taken an approach when I talk to students, and I give them a couple of general questions to think about every time they walk into a room to shadow. The first question is, what does it take to establish a relationship of trust? What do we have to do? Because that becomes really, really important. We know from our own experiences with our healthcare providers, we know that when we're in the room with our healthcare provider, that healthcare provider at some point is going to ask us some pretty personal, sometimes really sensitive questions, and we need to feel totally comfortable with our provider if we're going to answer those questions accurately and honestly. And I don't know if any of you have had experiences where you have felt less than comfortable with your provider. I certainly, looking back over my years and interactions with a number of different kinds of healthcare providers, I certainly have found myself in positions with various healthcare providers over the years where I have not felt totally comfortable with who they were, the kinds of questions that they've been asking me, the assumptions that they've made. And because of that uneasiness, because of that discomfort, I have not been completely forthcoming with my answers when I've been asked about certain aspects of, my social situation, my current health status, lots of things like that. So from that perspective, I know that in order for me to feel comfortable answering that question, I have to have implicit trust in the person that's sitting across from me. And I want to tell you now, as aspiring healthcare providers, that trust is not a given at all. That's not something that we can ever assume that we walk in is simply because we walk into a room and we happen to have on a white coat and a stethoscope around our neck, or we happen to have on some other paraphernalia, some other garb that identifies us as a healthcare provider. Just that presentation of us does not guarantee us at all that we have our patients' trust. That's something that we really have to earn, and we earn that through demonstration, through our acts, through the way we talk to them, and the way we frame the questions, the way we frame our inquiries. That has a lot to do with whether or not our patients ultimately trust us. So we're going to be looking at that. So that's the first question, is how do we begin to establish a relationship of trust? And then the second thing, along with that, we also need to sort of be aware of, as we're thinking about establishing a relationship of trust, what are potential obstacles to that? What are some of the things, and some of them may be things that simply exist, but some of them may be things that are part of our communication skills. What are the things that exist that may be potential obstacles or may make establishing that relationship of trust more difficult? The question that I've asked a lot of students now when I talk to them, that's very simple. As they walk into a room with the preceptor that they're shadowing, the question that I've asked shadowing students to ask themselves is, does the provider look like the patient? And that's a really, to me, so simple a question, but one that unearths so many potential areas of conflict or of problems in establishing that relationship between a provider and a patient. So what do I mean by does the patient look like the provider? Well, I mean that simply as you look at the patient and you look at the provider, do they look similar or do they look different? And that's not hard to figure out. These are the most basic things. Let's start by gender. Is one a man and one a woman? That may be a problem. That may cause difficulties, and I'll explain a little bit more what I mean. What's the age difference? Is one an old codger like me, gray hair, kind of walking in going, and the other person a very young person? Is there that kind of a difference, or vice versa? You know, that you could have an old provider and a young patient, or as challenging, an old patient and a very young provider. And again, we'll talk a little bit more about that. We can also talk about race and ethnicity. You know, are people of the same color? Do they seem to come from the same culture? Do they speak the same language? The last area is socioeconomic status. Does someone appear to be of the same kind of socioeconomic background as their provider? Because that can also lead to potential difficulties. So what do I mean by that? Let's start with age. I like age just because I'm old. And over the years, I'm old and I was a pediatrician. So it was always interesting for me as an old guy to walk in a room and see my patients. Because a lot of times when I was looking at a 10-year-old or a 12-year-old and they saw an old guy, they were not really interested in interacting with me. It was like, I'm an old guy. What can I know? Or what can I know about them? Or why would I even be interested in them? I guess all of those things may have all factored in some way or other to the way patients in my past have reacted to me. But I appreciate that, and but that also meant that I had to make the effort to really demonstrate to my patients, and my patients always were my children in the office, not their parents. My patients were always the children. And it was always important for me to never lose sight of the fact that my goal was to establish a relationship of trust with my patient. Now, along with that, I also had to establish that same relationship of trust with their parents. But initially, it was with the patient. So there is that effort. So I want you to look for that. I want you to look and listen for efforts that the provider makes to establish that relationship, and be aware of things that are specific, maybe specifically a part of the discussion or a part of the conversation because of the difference in age. Gender, interesting kind of challenge. A lot of times, we still we're slowly growing out of the gender stereotypes that are associated with certain professions in healthcare. But certainly the generation before me and much of my generation, we still have the attitude that if a woman walks into the room, that person is not the doctor. That person is the nurse. So as a young woman, as an aspiring physician, a young woman walking into, you need to understand that. You need to be ready for that there may be that assumption that you're not the doctor. And that may be something that you need to take some time to clarify that, yes, indeed, even though you're a woman, that you are indeed the doctor in the room. Race and ethnicity, that is even bigger, is even a bigger issue a lot of times. Now, in New Mexico here, we live definitely in a multicultural society. The breakdown of our state, we have about between 40 and 45% Anglos in our state. About 45% of our state population is Hispanic. And then another 10 to 12% are Native American, and the remainder are other groups of people. So we have a lot of racial diversity. We also have a lot of ethnic diversity. So when someone walks in that's a different color, then that also can potentially present an obstacle. Now, I walk in, I'm Anglo. If I walk in and I'm taking care of a family who happens to be brown, then that is something that I need to be aware of. I often share with students that in my past, I was actually fortunate enough to walk into a room once meeting a young couple with their child. They were here, they had come to the hospital. I was going to be caring for their child. And in the course of our conversation, the father actually stopped sort of mid-sentence and looked at me and said, "Dr. McKinnell, I'm actually concerned that because you're white, you're not going to give my child the same kind of care that you give to a white child." I say I was lucky to hear that because a lot of times those concerns are concerns that are never verbalized. They exist, but they're never verbalized. We never have the benefit of actually hearing those concerns from our patients. That doesn't mean that those concerns don't exist. And it's really, really important to know that. And as shadowing students, it's important for you to listen for an awareness. For you on the part of the provider that you're shadowing, that you're listening for an awareness that they might be aware that those kinds of concerns might exist with the patient. I also, as a shadowing student, I want you to sort of look at the patient, look at the family. Are they comfortable with the provider? Are they showing signs, either in their speech or in their posture, that they feel uncomfortable with the person that's in the room that's supposed to be taking care of them? So we need to be aware of both things, but I want you then, once you've made that determination, and never undervalue your ability to make that determination. But once you make that determination, I want you to listen very carefully for efforts that are made to address that. That there is recognition that those kinds of concerns might exist on the part of the provider, and that there are specific efforts that the provider is making to address those concerns and move past them. Same kind of thing, I want you to sort of watch the family, and I want you to sort of see how they interact. Watch their eye contact that they make with the provider. Watch their facial expressions as they look at their providers. See how see what it appears to you, and see how it might change over the course of the interaction between your preceptor and the patient. Remember, it can change for the better. They can appear more comfortable. It can also always change for the worse. And be aware of both of those options. The last thing, socioeconomic status, I want you to sort of be aware of that, just because I think that when we think of that, a lot of times my concern is that a lot of times that's associated with educational level. And so I think that I want you to sort of be aware of that. And we're going to talk about this in the next video when we talk specifically about some of the communication challenges. But a lot of times when we see really differences in socioeconomic status, then we have to listen for the way that our preceptors think about maybe assessing the educational level of the patient that they're charged to take care of, and how they adjust the way they speak to them based on their perception of what their patient is able to understand. That's just the start. We have more to talk about, and we will in the next video. Thanks again for tuning in. This is Jim McKinnell, Director of the Office of Pre-Health Profession Student Development. I look forward to talking to you more about the challenges that all of us face as healthcare providers, and the kinds of things that we can be looking for as shadowing students. Thanks a lot.